Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. The topic is physiological integrity. The healthcare provider is seeing 4 patients at the neighborhood clinic. Which of these patients should the healthcare provider identify to be most at risk for iron deficiency anemia? Option A. The obese patient with a history of gastric bypass surgery. Option B. The patient who has a diagnosis of chronic renal failure. Option C. The woman of childbearing age reporting a craving for ice. Option D. The patient who follows a strict vegan diet. Right answer is Option C. The woman of childbearing age reporting a craving for ice. Menses may increase the risk of iron deficiency anemia in some women. Pica, the craving to eat unusual substances like ice or dirt, is a classic manifestation of iron deficiency anemia. Gastric bypass surgery may result in decreased intrinsic factor and absorption of vitamin B12. Patients with chronic renal failure require a specific diet plan. Iron deficiency anemia will not develop as long as a vegan diet is well planned. Before administering 2 units of whole blood, what type of intravenous (IV) device should be used? Option A. Whatever the doctor has ordered. Consult the patient's chart. Option B. The same IV device as previously used. Consult the patient's chart. Option C. A large bore catheter to allow blood cells to pass easily into the patient. Option D. The smallest possible catheter to prevent pain on insertion. Right answer is Option C. A large bore catheter to allow blood cells to pass easily into the patient. Large bore catheters are necessary to prevent damage to blood cells. This also decreases development of clots from hemolysis. An 18-gauge needle is often the standard for blood administration. A patient who is diagnosed with Parkinson's disease, PD, states, "I can't tie my shoelaces anymore." The healthcare provider recognizes that this patient's problem is due to a deficiency in which of these neurotransmitters? Option A. Glutamate. Option B. Norepinephrine. Option C. Dopamine. Option D. Serotonin. Right answer is Option C. Dopamine. PD is a progressive neurodegenerative disease that impacts the motor system. Dopamine helps the brain control movement and coordination. Neurons in the brain slowly stop producing dopamine in patients who have PD, making it increasingly difficult to control muscles for movement, including fine motor movement needed to tie one's shoelaces. When assessing a patient diagnosed with osteoarthritis, OA, the healthcare provider looks for which characteristic of this condition? Option A. Bilateral joint swelling. Option B. Joint crepitus. Option C. Decreased grip strength. Option D. Waddling gait. Right answer is Option B. Joint crepitus. Crepitus, also called crepitation, describes the grinding, grating, creaking, or popping sounds that occur when a joint moves. Crepitus is present when cartilage is lost. It is characterized by a popping, grating sound, or sometimes the patient feels bone rubbing against bone secondary to loss of cartilage. Decreased grip strength and bilateral joint swelling are more often seen in rheumatoid arthritis. The safest method of changing a patient's tracheotomy ties is to: Option A. Ask the doctor to suture the tracheostomy in place. Option B. Apply the new ties before removing the old ones. Option C. Change ties as soon as possible after the patient has eaten. Option D. Never attempt to change ties alone. Right answer is Option B. Apply the new ties before removing the old ones. The best way to change tracheotomy ties is to apply the new ones before removing the old ones. This keeps the tracheostomy in place during the process. With this method, A second person is not necessary. Besides, a helper might not prevent the patient from coughing out the tracheotomy. Wait 2 hours after eating to change the ties, to avoid vomiting from stimulating the gag reflex. Asking the doctor to suture the tracheotomy in place is not appropriate. During an arteriogram, angiogram, the patient suddenly says, "I'm feeling really hot." Which is the best response? Option A. That feeling of warmth is normal when the dye is injected. It will last up to 20 seconds. Option B. The heat indicates that the clots in the coronary vessels are dissolving. Option C. You are having an allergic reaction to the dye. I will get an order for Benadryl. Option D. Let me get your doctor to explain this sensation to you. Right answer is Option A. That feeling of warmth is normal when the dye is injected. It will last up to 20 seconds. Patients should be instructed that it is normal to experience a warm sensation when 4-contrast is injected. The feeling lasts 5 to 20 seconds. During an assessment of a patient experiencing acute hemorrhage, the healthcare provider would most likely expect to find Option A. Hypotension. Option B. Jaundice. Option C. Nausea. Option D. Tachycardia. Right answer is Option D. Tachycardia. The heart rate will increase in an attempt to deliver more oxygen to the brain and body. Tachycardia is a pulse rate greater than 100 bpm. The healthcare provider prepares to administer a corticosteroid to a patient with a diagnosis of asthma. What is the rationale for administering this drug to this patient? Option A. Promote bronchodilation. Option B. Decrease airway swelling. Option C. Prevent respiratory infections. Option D. Promote expectoration of mucus. Right answer is Option B. Decrease airway swelling. Corticosteroids and other anti-inflammatory drugs work by reducing inflammation, swelling, and mucus production in the airways of a person with asthma. As a result, the airways are less inflamed and less likely to react to asthma triggers. Inhaled corticosteroids are the primary treatment for asthma. A patient presents to the emergency department with a blood pressure of 180/130ths of a millimeter of mercury, headache, and confusion. Which additional finding is consistent with a diagnosis of hypertensive emergency? Option A. Retinopathy. Option B. Urinary retention. Option C. Jaundice. Option D. Bradycardia. Right answer is Option A. Retinopathy. A hypertensive emergency is a sudden rise in blood pressure, with a reading of 180/120ths of a millimeter of mercury or higher. Immediate intervention is necessary. It may cause hypertensive retinopathy, resulting in hemorrhages, exudates, and/or papilledema. Other consequences of a hypertensive emergency include stroke, heart attack, aortic dissection, kidney damage, and pulmonary edema. A patient diagnosed with ulcerative colitis is admitted to the medical unit. When assessing the patient, which of these findings would be of the most concern? Option A. Rebound tenderness. Option B. Oral temperature of 99.0 F, 37.2 C. Option C. Bloody diarrhea. Option D. Borborygmy. Right answer is Option A. Rebound tenderness. Rebound tenderness is a sign of peritonitis that could be the result of rupture of the colon. It is a clinical sign that occurs during physical examination, referring to pain upon removal of pressure, not during application of pressure. Bloody diarrhea is a common finding because of bleeding lesions and anal excoriation. A temperature of 99.0 F, 37.2 C, is within normal range, and chronic inflammation may keep temperatures within the high normal range or above. Thanks for watching. If you like our video, then do like, comment, share. Subscribe our channel for regular updates.